patient. It's got some alcohol swab sticks in here. It's got a very large Tegaderm dressing in here. It's got some extra tape, protective white cleaner. This actually has a slitted sponge. What do y'all think about that? What would be the pros and cons of using something like that on there? Anybody have any feelings about it one way or another? What do you think about a sponge? Something like that. It's going to cover up a lot of the site. Yeah, what else might it hold? Yeah, a lot of bacteria. Yeah, I don't think I'd really be using that, but this particular kit. Yeah, but what happens if it leaks around there and gets wet? What happens with moisture in breeding ground? I don't think I would use that, but some of your kids. So what are you going to do when it comes to central line care? Where are you going to get the instructions on how your facility wants it done? Their policies and procedures, because they're going to be supplying the kits and they're going to tell you what they want you to use. Okay, now some of these kits have got little bits of alcohol swabs in them. Okay. Now I'm not doing this sterile, I'm just showing you what's in here. But some of these have got little alcohol swabs in here to clean around here. Clean that first. Some of them have chlorhexidine swabs in here. Remember chlorhexidine from our catheters? Okay. And we would have probably 3 like we did before. We're going to clean from the inside to the out. Okay. But most of the latest research is saying it's really better to scrub. Let's see if I can get this over here. Can you see this little scrubber? This is probably the newest and the latest and the greatest thing that you're going to see in these kits. So you would squeeze this together, which would release the liquid, and you're going to actually come along and scrub this site with chlorhexidine. And can you see how that's probably going to do a much better job of cleaning it than... It depends on what's going to be in your kit. It's your facility. So that's why I'm showing you there can be several different options. But this is what most of the latest evidence is saying. And they're also saying that the scrubbing action, which makes sense, doesn't it? Like when you scrub your hands, the scrubbing action is going to help reduce the count a lot more. Okay, so if you did this and you opened up your kit, you're going to open up this sterile kit just exactly the way you open your catheter kits away from you. You're going to have taken your dressings off first, made sure you've got your mask on, opened this kit up, put on your sterile gloves, done your cleaning, okay? Then, if a biopatch is required with your sterile gloves, what would go down first? The patch. Shiny side would be up, and it would go down here. Remember, I've got my sterile gloves on, although I don't. What would go down second? Yes, the Tegaderm, and this one came with a large one. Large Tegaderm, and what would be the last thing that would go down? The label. Okay, now let me show you something else here. This is even more sophisticated. Let's see if I can get this to show up here. This is just a little simulated effect here. But here's a new little guy on the coming on the scene. Can you see this little thing right here that looks like a little football? Can you kind of see how that's split and it covers and it goes right over the little spots that are sewed in? Okay, and then what you'd come along, it just like you'd peel the Tegaderm off, you'd peel the paper off that little football, And that's more specifically designed for this particular type of site.
What's that called?
That brand name is called a Staylock, or Statlock, S-T-A-T-L-O-C-K.